This is Martin Gutenberger. I'll be talking today about how to read a chest CT, just the general search pattern that I use. The study I have today is actually a PE protocol, but the search pattern is more or less the same. You can see here this was a study that was done with a chest CT, but also had an abdomen and pelvis CT. So here we are. So the first thing I start looking for when I do a chest CT is I look for any lymph adenopathy. So I start looking in the axillary regions first, and I scroll up and down a few times. You'll see a few small little nodes. These little dots that flip in and out are little lymph nodes. None of these are pathologic. A few things in there are also vessels. The next thing after I look at that is I start looking at the kind of base of the neck. So I look at the thyroid gland real quick, and then I look for supraclavicular lymph nodes. So those will be in this area and in this area. You can also have nodes kind of posterior here as well. I still kind of call those supraclavicular nodes. After I've looked at these areas up here, then I start looking for nodes or masses in the mediastinum. So I start moving down, and I keep looking in the mediastinum for nodes. Most of your nodes are going to be here adjacent to the trachea, but you can have nodes like this. You can have prevascular nodes, you can have aortopulmonary window nodes, and then I look in the hilar regions for lymph nodes, subcarinal regions, and then I keep going down, follow along the esophagus looking for nodes there. I'm also looking at the esophagus while I'm doing that, and then I come back up, and then I generally scroll through the mediastinum a couple more times, just kind of looking in the anterior mediastinum for masses. I'm looking at the intramammary nodal areas. And once I've convinced myself that I've looked well enough at the mediastinum, then I start looking at the cardiac structures. So I look at the ventricles, I look at the coronary arteries. This is their left anterior descending, and then their circumflex artery here. Both of those have calcifications in them, so they've got some ASVD. And then I start looking at the major vessels. So I look at the aorta coming up, and then you can see this person has a aberrant right subclavian artery, just incidental, and then I look at the pulmonary artery. And on studies that are not done for pulmonary artery or for PE, I still look for PEs, but usually I'm looking mostly centrally. I do follow the vessels out peripherally somewhat, just to look for vessels, or to look for PEs, but that's about all I look for. And then at that point, I am done with my mediastinum search. I quick look and make sure there's no pericardial effusion. I scroll up and down and I look at the pleura, see if there's a pleural effusion, any pleural plaques or calcifications, and then at that point I'm ready to switch over to my lung windows. Once I'm in my lung windows, I scroll down real quick. I look at the trachea. I look for anything inside the trachea. Just try to make a decision about how well aerated the lungs are based on how flattened or bowed that posterior wall of the trachea is. And then I start looking in the lungs. I go up and down on each side, so I go through the lungs 4 times. The first time I look at the anterior right upper lobe, and I scroll down just looking for any nodules. And so usually that's going to be the right upper lobe and right middle lobe that I'm looking at that point. And then I start scrolling. Then I go through the lower lobe on the way up. And then I'll switch to the other side, and I'll do the anterior left upper lobe, come down, and then I'll do the left lower lobe, or kind of posterior left lung, on the way up. After I've looked through the lungs, I switch to looking at the upper abdomen. I switch to my liver windows. This person has pretty severe hepatic steatosis, so you can see their liver is a lot darker than their spleen. So I quick scroll through the liver, spleen. I always make sure I look at the pancreas or what I can see of it on the chest CTs, since you hate to miss a pancreatic cancer. Then I look at the adrenal glands, especially if you think there's a lung cancer on a person, and then whatever top part of the kidneys you see. At that point, I switch to my bone windows. Usually I focus on the spine on my way up. And most of the time, if you're going to see any metastases or anything, they're going to be in the vertebral bodies or kind of posterior elements. So I really am focusing on those areas. Then I just scroll through the shoulders, each on each side and make sure I'm not going to miss some sort of scapular fracture, especially if it's a trauma case. This person, you can see they've had surgery on their cervical spine, and then I scroll through the ribs on each side. Usually I kind of divide it kind of in the anterior and then the posterior ribs, so I end up going through 4 times. So I go down, look at the anterior right, and then the posterior right ribs, and then anterior left ribs, posterior left ribs. At that point, I usually think about what the indication for the examination was, and I try to make a differential diagnosis based on that if I haven't found anything yet. So if this was a CT for cough, I would just look through the lungs again, make sure there's no reason why this person may have cough if I haven't found it. Make sure I looked at the airways, because that's easy to forget doing. And just try to form a differential diagnosis and do any double checking in case I haven't found anything that explains the patient's symptoms. Then, before I close the exam, I go to the sagittal images of the chest. I look through the ribs. Sometimes I find that I can see rib fractures, especially lateral ones, better on the sagittal image. Then I go through the spine, make sure there's no compression fractures. I go from side to side through the spine and just make sure the neural foramina line up. And then I look at all the spinous processes, especially if it's a trauma, make sure there's no spinous process fracture. And then I go through the other side of the ribs. And then I'm done looking through my chest CT.